Hello everyone, I'm Ryan Fields. I'm the Chief of Surgical Oncology at Barnes Jewish Hospital and Washington University at the Alvin J. Siteman Cancer Center. First and foremost, I hope you and your families are all safe and well during these challenging times. I'd like to take an opportunity to go through a number of things related to coronavirus and specifically cancer patients, mainly with some important points that I think are very relevant and maybe unclear. Now, this may be changing on a regular basis, but I thought given some perspective from the cancer community at Siteman and specifically the physicians and providers may be helpful. The first question that we get asked a lot is, what exactly is coronavirus? Coronavirus is not a new virus per se. It's a virus that has many different types, and this happens to be a new type that's particularly virulent or can cause harm more so than most coronaviruses. Because of that, we've called it a new or a novel coronavirus, or the definition a lot of people are using, or the term is COVID-19, as it's this new strain. It is a virus in the sense that it is spread from person to person, and mainly this virus is a respiratory virus that's spread via transmission of small respiratory droplets from someone who has it. One of the main questions we're being asked by a lot of our patients in the cancer community is, if I have cancer, am I at a higher risk of getting the coronavirus? The short answer is, just because you have a diagnosis of cancer doesn't mean you're at higher risk. However, as many of you know, when you're going through treatment for cancer, whether it's surgery or chemotherapy or immune therapy, the immune system can be altered. So in general, patients that are undergoing treatment for cancer are at somewhat higher risk for infections, including coronavirus. So many of the precautions that we will be talking about, and especially safe social distancing, are very, very important for our cancer patients. So the logical question we're being asked a lot is, if I'm a cancer patient, how do I protect myself? Again, because cancer patients are no different than any other person right now in terms of trying to prevent the spread of this disease, the recommendations are really quite universal for all people, but especially for cancer patients. The first thing, and the thing I could not emphasize enough, is hand hygiene. This virus really gets spread by contact, and a respiratory droplet gets on somebody's hand and they rub their face, and the virus gets transmitted by getting into your mouth, your nose, or your eyes. So frequent hand washing is very important. You've probably seen this demonstrated quite a bit, but mainly you want to be washing your hands with warm soap and water for at least 20 seconds or using hand sanitizers. Washing your hands is probably the best, but the hand sanitizers are a good use or substitute when you can't wash your hands. The most important thing that we can do as a society and as small groups of people is social distancing. I am married and have 2 young children, and other than our unit of 4 people, we are avoiding all unnecessary contacts. What does that mean? Well, it means when you're out in public, if you have to be, it's only for essential things such as grocery shopping or going to doctor visits. Even some of our routine follow-up visits, we have switched to phone or telemedicine consultations. So avoiding contact with others where you would be within 6 to 12 feet is very important. There are also recommendations now that when you are out in public, you try to keep your face covered. And that's not to protect you, it's to protect others from the respiratory droplets that may come out of your mouth and spread around. So it's really something we can do as a society. What can you use? Well, we all, and many are familiar with Pedal the Cause, who made these wonderful bandanas. This is what I use when I'm out in the grocery store. I'll show you exactly how I use it. I keep it around my neck, and when I go out into the store, I pull it up over this like a bandana and wear that to cover my nose and mouth so I'm not spreading the virus. It's simple because then I can take it home, I can throw it in the wash, and I can keep reusing it so I'm not using another mask that I could otherwise use or a colleague could use at work. Along with those measures, another important thing we can do is just to avoid touching our face. A lot of us do that inadvertently when we're sitting at a meeting. We bring our hand to our face or we adjust our glasses. And as we can consciously avoid doing that, we would also limit spreading the virus unnecessarily. In general, part of avoiding unnecessary contact would mean trying to limit the times that you have to go to places like the grocery store. So stocking up on medications that you may need for the next couple months by mail order or your pharmacy would be important. Trying to limit your grocery store trips to once or twice a week as much as possible. And trying to identify ways in which, when you're at the store, you can avoid unnecessary crowds or lines. The other thing that you can do is, again, avoiding unnecessary travel. Essentially, we are all going to be living at or around our homes and going out of the homes when we need to for mental health and exercise and essential services in a socially responsible fashion. I've been exceptionally proud of the St. Louis area and in particular our patients in scheduling things like telemedicine and phone and video visits in lieu of in-person conversations and consultations. It's been remarkable how adaptable and flexible everyone has been. The other question we're being asked quite often is, I'm a cancer patient and I can't get my treatment right now, what should I do? We are prioritizing the treatment of patients who have more aggressive malignancies as new patients or patients undergoing active treatment where a treatment break or delay would cause cancer progression at an unacceptably high rate. What does that mean? Well, we see a number of patients that may have a slower growing tumor or cancer where a treatment delay of 4 to 8 weeks would be acceptable, especially given the risk of coronavirus. If we need to do that, we are contacting and discussing that with patients, and importantly, we're doing that in conjunction with larger societies and organizations that are making these recommendations. As physicians and care providers, we would never recommend delaying treatment if the risk and the benefit would lead to a problem in that patient's cancer progression. Rest assured, all of the providers at Siteman, especially the physicians, the nurses, the physician extenders, and everyone who's working in cancer care, have had numerous meetings and discussions and consultations with other experts around the country to try to really balance the risk of cancer treatment delays with the risk of coronavirus. One question we also get asked is, I'm on a clinical trial, what should I do? We've reviewed all of the clinical trials and continue to do so at Siteman Cancer Center and are updating many of the trials with what to do during these times. As all of you know who are on a clinical trial, the clinical trial coordinators are your best contact point. They most likely will have already reached out to you with what to do for routine visits and scans and treatments. If not, please call your coordinator to discuss what to do next, or call your physician's office so that they may put you in touch with the best contact person for that clinical trial. In a big picture sense, clinical trials are continuing when we think that their therapeutic benefit of helping patients outweighs the coronavirus risk. We are also asked, if I'm a cancer patient and think I have an infection or coronavirus, what should I do? The main thing that you can do is make a phone call to your healthcare provider or call the coronavirus hotline at Washington University, where they will review your symptoms and recommend what to do. It's very important that if you have mild symptoms such as fever and a cough, but are not having difficulty breathing or other more critical issues, that you stay at home. You will be directed to a way to get appropriate testing if indicated, but we would want you to stay at home and isolate to prevent the spread of the virus. Really, the reason that we bring patients into the hospital with suspected coronavirus are for more serious symptoms that may require supplemental oxygen or other support. But we would only do that if we thought the risks of bringing them in were outweighed by any potential benefit of being seen and treated at a medical facility. I'd like to invite everyone to keep your eye on the Siteman Cancer Center website and social media outlets for future question and answer sessions that may be of interest where some of these questions can be addressed. I'd like to close by thanking the community of St. Louis and in particular the cancer patients and providers in our region. I think we have an exceptionally talented group of care providers and a wonderfully compassionate and amazing group of patients that are incredibly flexible and understanding during these times. Our dedication at Washington University and at the Alvin J. Siteman Cancer Center is your health and well-being. We are here to help you, and we look forward to seeing all of you again face to face during happier and healthier times.